We know at this time that taking care of a family member can be very difficult, and that's where Dignity Health Hospice comes in. And Lorraine and Sherry are here with us this morning. How are you two doing?
Good, thank you. How are you?
Good.
Great.
Lorraine, let's talk about hospice at this time and how it has taken effect on some family members with the COVID and how you are helping those family members through this all.
Yeah, I speak to our community when I say our commitment really is to our patients and our families and our community. Now more than ever, we focus on our goal to keep them out of the hospital and in the comfort of their own home. We really want the community to know that even during a pandemic, we're supplied with all necessary PPE and safety measures to still ensure that high quality comfort care, and we do not need to move you out of your home. We really step in wherever the patient is, and we're there for them anytime they need us.
Yeah, you said something very important, that is not taking a family member away from their home so that they can be there with their family, be able to rest in the time at this where they're very much unsure about when they will see their family or if they have to go to the hospital. And that's what's so important. Now, who helps cover this? Who helps take care of this for families?
One thing that I wish was common knowledge with everyone is that Medicare actually covers 100% of the hospice benefit. We know that it's hard to care for family members. It's a hard process, and we just want all the families to know that it's our job to step in and ease that transition and ease that care. And hospice, your Medicare benefit is something you've paid into your whole life, and it's there to use whenever you need it. We cover medications, supplies, equipment, anything that's related to the patient's diagnosis.
Yeah. Sherry, you are a nurse. How long have you been with hospice?
I've been with hospice 20 years, Brad.
Yeah.
I've been a nurse for 53 years.
Yeah. And so you know about, of course, being there for these families, and a nurse is very important this time. Can you tell us a little bit about what you do while you're there with the families?
Absolutely. The nurse is really a leader of a team that works with the families. My goal, number one, is I'm an advocate for my patient and my families first. It's important to know that this is a very private time in their life. So I am there to help guide them and to care for them. This is their end of life, and this is their last journey they're going to take. So it's absolutely necessary that we show them love and compassion, education, and be there to just lead them through this sadness that they are facing.
Yeah. And Lorraine, we want people to understand that you're there for them. You're there for people who might not need your services yet, but you're there to guide them for when that time comes. Am I right?
Absolutely, absolutely. Sometimes families may not be ready, and we're here to coach and guide and can help them lean into that transition and just let them know it's more of a help.
Yeah, and I think it's amazing at this time when we are in this pandemic, where family members are scared to reach out to someone like you when they do need help, and you're asking them, no, please come, let's talk. You have the nurses, you have the people there for them, and as you said, you're being very cautious with the COVID-19. So,
Absolutely.
Yeah. Tell us more where they can find out about Dignity Health Services.
You can look us up online. We're dignityhealthhospice.com. We service all of Maricopa County. Find us on Facebook, find our website, on Yelp. We're all over the internet.
Yeah.
Our phone number is 623-233-6461 if it's a better help to talk to someone in person.
Yeah, and again, at this time, it's very important to have a support like you do to people, so we thank you very much.
We appreciate you as well. Thank you.
May I add something, Brad?
Yeah.
It's important as a nurse that we have PCPs who refer their patients to us, and as a nurse, I email or I fax reports on those patients because they've had them for a long time. So they like to know the outcome. They don't always follow them, our medical director does. And I also like to have them do face-to-faces, phone, and Zoom with the families because they're very isolated now. So I do that and it reports to the families. Communication right now is key with this COVID.
It is, and I think it's very key that I know it's a hard subject for families to talk about and people to talk about, and that's where, again, you all come into these people's lives at a very important time, which is so important. So we appreciate you being here on our show, and we appreciate what Dignity Health Hospice is doing for families out there. So thank you, ladies.
Thank you.
Thank you.